person-centered service transformation for disability, older people, and mental health service providers.
We have this initial graphic here which illustrates the care continuum from assessment through safety, risk management, the care planning process, delivery itself, the review process around those plans, the coordination of activities across agencies and across individuals, and doing that process in the context of delivering care in the context of a person-centered focus. And that's essentially the process that we focus on in the context of service delivery from the perspective of this particular discussion here today. And there are a number of things that we have seen working with 70-odd different implementations of iPlanet across larger, smaller organizations internationally, right across the UK and further afield in Australia and New Zealand. You know, there are lots of organizations working within mental health, older people and disability sector that have got common issues that have been associated with traditional planning approaches which are primarily paper-based. They come down to the issues highlighted here around paper silos, whether that be at the assessment level, siloed information within the planning information, siloed information to manage risk, and then that risk around safeguarding which can come out of that because you get disconnect between different groups of people not basically knowing where the current situation is at. In terms of tracking progress with individuals, it can be often very difficult to do that within a paper-based context. It's often difficult to do the escalations, notifications associated with risk in a way that's integrated, timely, and anticipating issues in advance of them arising. And that can all lead to delays and lead to costs and can lead to poor governance and poor decisions relative to information being provided to management, funders, and other stakeholders. And certainly in a paper-based world, we've seen providers struggling with the issue of how better to include and empower and offer control and also extend the service into the extended circle of support, which would be beyond the individual themselves, but potentially family, siblings, carers, and others. And that opportunity presents itself, therefore, as service providers move more towards a world where paper is slowly getting replaced by opportunities presented by innovation, technology, mobile working, and so on and so forth. It does lead to service transformation opportunities, which hopefully will become more apparent during this presentation. Some of the challenges that have the bigger picture macro issues that providers we have seen, and we've listened to many executives talk about these issues, which have become increasingly to the fore, many of them in the UK, particularly since the advent of issues around austerity, really essentially driving providers to try to figure out ways to do a lot more, but having less resources to do so. And I know it sounds a little bit trite, and the phrase gets repeated quite a lot, but we're looking at it from a particular perspective here, where individuals within organizations, managers within organizations, stakeholders are struggling to figure out how they can move towards personal budgets, how they can drive that evidence to clarity and make it available to funders, how they can provide more person-centered services, how they can drive down costs, how they can address increasing burdens in the whole area of compliance and reporting and the paperwork associated with that, and also how health, social care and other agencies can collaborate better together. So there's a lot of issues that providers are struggling to deal with, and trying to deal with it on the right-hand side with fewer resources, fewer people to work with, fewer financial resources, and a lot of churn within the industry in terms of staff retention, a lot of turnover, and so on and so forth. So, a very challenging environment for providers. And part of the answer will be information. We're not saying that this is a panacea, that it is the answer to all challenges for all providers and the answer to all these issues, but it can help drive some of the transformation agenda which can be part of an overall organizational change program. However, information based on a paper-based world is challenging. It can lead to a lot of extra cost if one wants to be able to make informed decisions in a way that are going to meet some of the challenges outlined at the left-hand side. It is very challenging. So Aspirico has come at this problem from a relatively unique perspective. Instead of looking at the problem from traditional technology perspective of measuring inputs, measuring time and task, we've been coming at it from the perspective of measuring impact through an outcomes-based approach, which is built around a person-centered and inclusion-driven philosophy. So that we've summarized here as the VITA, which may be a little bit sludgy, but it certainly summarizes the key drivers around evidencing value, which has come much more to the fore for executives with providers right across the board now, where things like co-production, outcomes-based commissioning, where funders are looking to really get evidence that providers are making a difference based on information gathered at that point of care. And doing that in a way that is transparent to individuals is even more powerful. It is even more compelling if providers can say, look, we've gathered this information about outcomes achieved, we've gathered this information about compliance with CQC standard XYZ, and it is based on information gathered at the point of care that is live, and it can be, if needed, accessed by the individual. They might not log in every day, but they or their family can have access to it, which provides a level of sort of honesty and transparency into the process that is very consistent with a lot of the personalization and other initiatives across the organization. So one of the things that we want to focus on the presentation today is really what I call closing the loop. And that is something that we feel that iPlanet is bringing uniquely to the sector for the first time, in that traditionally a lot of providers of technology into the sector have provided time and task, so for example, rostering systems, work management systems, and there are some examples of web-enabled person-centered plans, but bringing that all together in a way that links into the financial system and meets funders' needs is something that's unique and has not been really well done before. So working with a number of providers over the last number of years, we've gradually filled out iPlanet in a range of new areas, and we'll be hopefully covering those off in part today. But uniquely, what we've also done is, in addition to the traditional approaches we've had in versions 1 and 2 and 3 of iPlanet, and subsequently of the core areas of measuring impact, allowing providers to track that outcome, track the progress, making sure that that's linked into assessments and plans in a way that's live and that's consistent and is not siloed. As part of our most recent release this month of iPlanet 5.0, we're adding in and integrating in a closed-loop way the activities of staff to support the achievement of those outcomes in a calendar and scheduled format, tracking that, allowing that access to management and to staff themselves, capturing the information associated with delivery of specific areas of service. So if Jane needs to be supported in the area of independent living, and there is a particular activity associated with that, and staff members spend 2 hours at a particular rate, and that's being funded out of a particular pool within Jane's budget. All that information can be captured for the first time and done so in a way that's person-centered and that is very much driven out of Jane's plan, Jane's outcomes, Jane's ambitions, Jane's desires, Jane's aspirations in life. And that can be then linked through to the budgets for that individual, rolled up into overall budgets for the provider. So that closed loop between is the work done, has it been delivered, how much did it cost, how much of the outcome is achieved, what percentage of it is achieved, what percentage of it is not achieved, how much money is left in the pot for that outcome, how do we roll that up, can we send the fact that that information is, that work is now completed to a financial system or into a funder portal so that we can get paid for that work. So it really starts to open up a whole vista of payment for results, payment for outcome achieved in a way that is very person-centered. And that's what iPlanet 5.0 does on the left-hand side in a way that is somewhat unique. The top right-hand side is areas that we've worked and proven with many providers over the last 5 to 6 years, and we're very excited about the potential of being able to close that loop and really drive tremendous value for providers and funders, because they ultimately are becoming much more exercised about the need to be able to have that evidence linked into the whole funding model. So that's really where we're at today, and that links into the positioning of iPlanet, whereby traditionally, whilst a lot of larger providers would have had traditional back office systems, iPlanet has always focused on the top right-hand side of this quadrant here, which would be, you know, measuring impact and outcomes and addressing the needs of frontline services. But now version 5, as you can see, with our dynamic task management and funding and contracts and what we're branding as this whole scheduling activity of what staff are doing on a weekly calendar type basis. And that's something that's starting to move into more of time and task, but doing it in a way that's person-centered. And in that way, iPlanet is supporting that service transformation agenda for all three constituents. It's doing it for the individual themselves at the bottom, including providing inclusion, control, transparency, and ownership. It's providing assistance in meeting the challenges for providers in the middle from a supporter perspective in terms of coordination, escalations, notifications, risk management, but also now starting to help supporters track their activities. What are the things that need to be done for Jane this week? Where are that coming from? Some will be scheduled, some will be in a weekly schedule of care activities, some will be driven out of outcomes and out of the plan. And how do you bring all that together in a holistic way that's easy for staff to use in a mobile environment? And then at the top, rolling that information up, gathering the data in a way that managers and funders can make informed decisions about really driving value for money, not just out of providers as and individual service delivery, but from a whole system-wide perspective, which is something that technology has always had that potential to help transform and move this sector forward. So very briefly, for those of you who haven't seen this before, how does iPlanet do that? Well, essentially, if you think about planning and service delivery continuum in a paper-based world, on the left-hand side you have the plan, you either have a 6-month or an annual review, and in the context of iPlanet you've got these loops whereby using your iPad, your mobile phone, your laptop or whatever, staff and people working with the individual, or indeed the individual themselves, if needed, can drip feed information in terms of progress around progress on that plan. Did the plan happen? Were the outcomes met? Is the person's life getting better? And get rid of all the delays associated with setting and delivering outcomes and recording information. And in that way, the plan can stay current, outcomes are tracked, evidence is captured, everybody has updates, and organizations at a management level can drill down, identify for CQC standard XYZ, we've got 200 outcomes, of which 150 are not achieved for reasons of lack of funding in the Southwest, for example. So these kinds of information analysis capabilities are really coming to the fore now with this full closed-loop system in iPlanet in a way that is of increasing relevance and importance to management. And we certainly are seeing that across all of our providers, whether you're talking about working with the, we've got quite a number of implementations up and running now with large and small providers across Australia, in New Zealand, right across the UK, the whole area of using information in a way that is current and that is linked to the delivery of care and that is built around outcome frameworks that are either based on statutory or provider-specific requirements is becoming a really, really important driver for quality managers, for quality directors, for heads of operations, for CEOs. We're seeing it as something that whilst iPlanet in some way was ahead of the market 5 years ago when we launched this originally, you know, we've certainly seen that it's starting to mature now to a point where it's becoming mainstream. So there's lots of different areas where that information can be combined with the information in the center, which is essentially your client database around the profile for the service user and that related data around the assessment data, you know, the progress data and the KPI and so on, to meet a constellation of information needs from a management point of view. And as I said, you know, we've picked up a lot of awards over the years doing that with starting off in that learning disability world, but increasingly working in mental health, older people, and moving into the general vulnerable people, supported employment area as well. But always coming at it from the perspective of, instead of moving information from a input measurement perspective, we're really coming at it from the philosophy of measuring impact, and that's consistently what we've been doing. And it's in some of the recent surveys that we've carried out with our existing providers, where in this context, and I have a few slides, I'll quickly run through them here, you know, in terms of supporting management decision making, 95% of providers have seen more accurate, easier and faster decision making, allowing providers to respond to change. You know, improvements in outcome completion, one would expect that. We've always had a good result in this area when we do our surveys. 85% providers showing a strong result there. Inclusion and personalization, 95% of providers seeing something positive happening in that area. You know, in the whole area of risk management, again, once we introduced the whole area of assessment and integrated risks and making sure they were dynamically linked into people's plans, that was an area where we've seen transformational change from a provider point of view. Evidencing value, again, this is the key one that I mentioned earlier on, that you know, partly driven by austerity, where funders have limited resources, they really want to be able to see that providers have gathered this information and have a system in place to do it systematically and do it accurately. And, you know, we have seen lots of providers take iPlanet tenders, or sorry, reports and append them to tenders as part of their business development activities. It's becoming much more critical for providers now to be able to underline the difference that they make for the individuals they support, and particularly if providers have an extra premium that they have to charge because they provide a more intensive set of supports or whatever. But even within sort of lighter touch and floating support services, it's still very valuable to be able to capture this and to be able to illustrate it to commissioners in a way that highlights the quality and the value of the service from a client's perspective. This area, again, is linked to that quality, but more from a compliance point of view. Again, a question to show that, you know, the vast majority of providers have seen support improvements in that area. This is a response in relation to how iPlanet has impacted the person-centered practice. Some providers have put a lot of effort into this area, and obviously iPlanet has a lot of templates, a lot of good practice that we've accumulated over the years. We've literally, you know, thousands of library of templates, whether it be plan templates or, you know, assessment templates, approaches to risk management reports, and so on and so forth. And a lot of that is built around the work we've done over the years in the whole area of person-centered thinking, and many of our consultants have got formal training and experience in that area. So it can certainly help in that area. And the final area, from the financial director point of view, is, do we have a return on investment here? Has that been seen? And certainly we do have tools to measure that, but it is something that increasingly providers need to be able to show that any investment is going to pay for itself and some. And this again is some feedback in that context with some quotes. A quick run through of the key points in terms of how individuals can see their plans in iPlanet, how that links through to the staff member, and how that links through to gathering information from a manager perspective in order to be able to support the kind of objectives that we just talked about earlier on.